Hello everyone and very good evening to all of you. Hi everyone. Let's first see that whether my audio and video is okay or not. And if all is fine, we'll then start. So very good evening to all my final and pre-final CS students. This whole session is all about you, where we can discuss what are the things that we should keep in mind while we're preparing in the final year and the pre-final years, because the time is short and we don't have a lot of seniors to guide us because we are not going to the medical colleges. So considering me like your medical college senior, let's have a small discussion into those things. What are everything that you should do, and those things you should not do to ensure that your preparation is not at all now from the best is not at all less than the best. That is all we are here for. If you have any thoughts, yes, very good evening to Robin Singh and Neem Flower. Very good evening to all, both of you. So, the basic idea again I will tell you is to ensure that whichever doubts that you have, we'll try to ensure we can find out a good solution to that, because maybe you are facing some issues in studying this subject, or you were not able to exactly grab the fact. Okay, how should you prepare for the upcoming NEET exam, and if you're actually preparing for the next exam, so what you should take in mind while you're actually doing that. So guys, I have a few basic things I'll first tell you and will then move forward. Dekho, when you move to the final year, there are a lot of subjects that we actually not even know of. But apart from the medicine, surgery, gynae, pediatrics, apart from these 5 subjects, so I'm considering 5 because gynae and obs are completely 2 different top subjects. There are few other short subjects we should also be very much focused upon. What students forget is, see, they get so much engrossed in reading medicine and surgery that they actually forget that they have some other short subjects also. Please remember one thing, that the number of marks that actually is considering in medicine, you get 1 marks. The same number of marks you also get in solving a question from anesthesia or radiology or the orthopedics. So the point to understand here is that we should give a due importance to every subject. I'm not saying that the anatomy, the medicine should be given as equal as the amount of time that should be given to radiology or say a psychiatry. But yes, you should be able to divide your time so that you can also cover radiology, anesthesia, psychiatry, and those, and you should not forget reading those. Now, will increase in the MBBS seats or decrease its craze? So not at all, because increasing in the MBBS seats is a basic requirement of our country, and that should be there. I did not have confidence in my first and second year subjects. What can I do now? It's a very good question. That is what we are here actually for. So I have a few things to tell you. Dekho, first of all, I told you the one fact that the amount of time that you should give for suppose medicine, surgery, gynae, obs, and pediatrics, it should be accordance to the number of marks that it has. So please ensure that when you're reading these long subjects, do not miss the importance of the short subjects also. Yes, the amount of question is not very high, but yes, the number of marks is equal. So do not completely ignore them. Secondly, let's talk about in a very clear manner that what are those things that you should take care in mind when you're reading a medicine or a pediatrics in the final year. So I would suggest that 2 subjects is your key. One is Pharma and one is Path in the second year. In the first year, it is very important to understand the importance of anatomy in understanding the importance of surgery. Now, what I'm trying to say is just pace yourself ahead. Try to understand that when you're reading any topic of medicine, for example, you are preparing for a cardiovascular system, so at the same time, please come back and read the same topic from your second year books. Now, whichever book you have read about. Let's not change the book right now. But suppose, let's say an example, that you are reading hypertension in medicine. Okay. Now, you all know, suppose I talk about this in pharmacology. Then pharma, in the CVS topic, 5 topics I'll say is very important. If you want to note it down, you should note it down also. Like hypertension, congestive heart failure, angina, myocardial infarction, and arrhythmias. So these 5 drugs are must and must to read. Believe me, out of these 5, 4 of them are also very important from the pathology point of view. What are those? Hypertension, congestive heart failure, angina, and MI is very important. Even though we'd go ahead and also read the cardiomyopathies, but these are must and must to know. So what you do is, when you're going to the topic of cardiovascular system to read from medicine, ensure that you just open your second year book once and read the pathophysiology part from those areas, pathophysiology parts. Try to cover those pathophysiology parts from the surgical notes that you have made, or maybe the books you have read, and then try to read about the drugs. Now, many students ask me, so there's so many drugs in pharmacology, and I don't know anything about it because now I moved to final year, and the things were not also very clear to me in the second year. How can I make it clear right now? See, let's be very frank here. What was happening in our second year days is we actually read in the last 1 or 2 months before the exams. So we just completely mugged everything up and we vomited the same thing in the exams. It's not actually possible for you to remember so many drugs after reading of just 2 months. So what you must do is do not focus on every drug in pharma. Please understand the basic questions asked in pharmacology is upon the mechanism of action and the most common side effects. So do not go into reading the lot of classifications there, because ultimately the classifications say that, there is something called as a scientific classification in the form of drug formulation classification, and there's something called as mechanism of action classification. It is always better that you read the mechanism of action classification rather than just reading the classification from the point of view of molecules. Okay, so always try to read what is called as a mechanism of action classification in pharmacology. Let's now move to next topic, for example, CNS. Now see, CNS में three topics you all know is very important again: sedatives, hypnotics, and epilepsy. Now, if you look at these three topics, the same thing is also important from the medicine point of view. But remember one thing: the drug of psychiatry, the entire psychiatry can be covered in a good manner if you come back to your second year days and read these three drugs: depression, psychosis, and anxiety drugs from the second year, because these three make the actual key in you knowing everything from there. Now, when you're reading the CNS in the final year, try to read a few topics also from the pathology point of view, like read about read about the Alzheimer disease and read about the Huntington's chorea is very important from the pathology point of view there also. Not to forget the CNS tumors, which is more important the surgical point of view. Okay. See, I'll just take few questions before I move ahead. So, what to do in pre-final year? Which all subjects must be done before going to final year? A very good question by Sijo Jose. Dekho Siju, when you're in pre-final year, ensure you do not miss first of all the three main top subjects, BSM, I, and the ENT. But looking at these facts, please ensure it depends upon what was your preparation level in second year. That means what I'm trying to say here is, dekho, I'll just write it down for you. It should be very clear here. Let's assume in your second year you have taken a video lectures or you have taken a coaching. Okay, so in your second year, if your path and pharma, these two are almost like complete. Okay, so you should first answer yourself, is it true? So if it's complete, then in the third year what you must do is, in the third year, try to read mainly at least two subjects, mainly medicine and surgery. Now this can be read with the help of either a live class, or you can do with the help of videos. Whatever you have, it can be due to live classes or can be due to the recorded videos. But suppose in this your answer to this question is no. Okay. Now please understand, if you again go back and read this main things in the just before the next exam, it will be really difficult for you to do that. So what you must do is try to cover these things in the first 2 or 3 months of your third year as well. That means if you have not covered your second year from the path and pharma point of view, just in the first 3 months, try to read the path and pharma very well. Maybe after passing the exam, you don't have that pressure that you have to read everything. So what you must read is only about in path and pharma. Try to understand in path, you must read systemic pathology plus in hemat, and along with this, one topic I'll take from general pathology is completely just only and only immune system. That's it, nothing else. That's it, nothing else. So try to understand the importance of these three things in the pathology point of view. From pharma point of view, I was just talking about the same. I'll continue the same thing. What happens in pharma is, so first of all, I told you from the pharma point of view, try to read from the CVS. I told you, sorry, from CVS, I told you, try to read the hypertension, congestive heart failure, angina, MI, and arrhythmias. In the CNS, try to read sedatives, hypnotics, and epilepsies. In the psychiatry, always try to read depression, very, very important, depression, psychosis, and anxiety. These are very, very important drugs if you read about the pharmacology point of view. Now, when you move to endocrine, you see, you cannot move to endocrine without reading the anti-diabetic drugs. So just when you know that is important, try to cover that also while reading the diabetes in the final year. Okay. So diabetes is very important in the endocrine chapter, the OCPs and the drugs for infertility. Because see, the drugs of OCP and infertility is very important from the gynae and obs point of view. What I'm trying to say is, when you move to final year, you just come back and read this topic from the second year as well. So I'm not saying read extensively. I again told you to focus on two main things. Number one, side effects. Number two, mechanism of action. And please understand that classification of pharmacology drugs should be done mainly by the mechanism of action, not by the scientific molecules that they are. Okay? Achha. Now talk about the thyroid. So in the thyroid, when you read the thyroid from supposedly a surgical point of view, you must be knowing the importance of those anti-thyroid drugs. Just come back to again pharmacology and read the anti-thyroid drugs and when should they be applied. So different drugs have different mechanism of action, because of which the application becomes different, right? So try to read the mechanism of action in the anti-thyroid drugs. Then when you move ahead and try to then move to the respiratory. See, in pharmacology, respiratory has mainly two topics important. One is asthma and one is COPD. That's it. Most of the drugs of asthma and COPD will cover the entire drugs of the respiratory system, because as such, the medicine also doesn't have a lot of drugs to be covered there. When you move to hemat, in hemat, at least when you say pharmacology, you do not consider the entire tumors, you only consider the anemia there. Now see, when you move to anemias, you all know that most of the anemias will be treated only with the B12 and the folic acid treatment. But when you move to the especially iron deficiency anemia, you should know the role of the parenteral therapy and the role of parenteral therapy over oral therapy, and what is the time period for which you must continue the parenteral therapy. Now, should you stop the parenteral therapy as soon as the anemia gets okay? No, you should just continue forward till the time that the stores are also replenished. So that is very important to understand the iron deficiency anemia and its treatment. I'll just move to one more fact of coagulation. See, what happens sometimes is students are more concerned about knowing new drugs in the antiplatelet drugs and those, while they're not able to understand the importance of the basic drugs like heparin and heparin, right? So what we must do is first go to the pathology point of view, read the entire chapter of coagulation chapter. From that, you have also in the coagulation considering the platelets also. Read the platelet mechanisms, read the antiplatelet drugs, read the coagulation mechanisms, and read the anticoagulation drugs. Okay? Achha. Then move to dyslipidemia. Very, very important from this pharmacology point of view is dyslipidemia. You have to know, again I tell you, please understand that when I'm saying these drugs in pharmacology, I'm not at all meaning you, I don't want you to read everything in pharmacology. Focus on basically the mechanism of action and side effects, that's it. And the classification based on mechanism of action only, okay, of dyslipidemia. Okay, before I move ahead, I'll just take a few more questions here. Do we need to study pathology and pharmacology separately first before starting medicine, as we have to study this with medicine part also? So very good question, Shalu. What happens, Shalu? When you're reading a subject, for example, let's say an example. See, you are going to read respiratory today from medicine, respiratory system from Harrison's or Davidson, whatever book you have chosen. Okay. See, believe me, the main topics you'll read in the respiratory system in any subject would be mainly, and I can guarantee you'll read only this thing. You'll basically read what? ARDS. You read about pneumonias and its treatment. You'll read about all the COPDs, including the two main, that is the chronic bronchitis and the emphysema. You'll surely read about the asthma. You can't just ignore asthma. It's very, very important, right? And then bronchiectasis. Okay? And when you just have read all this, believe me, these all are the exact things that we are actually teaching in the pathology point of view also, because we know that these are the topics important from the medicine point of view. So ensure that when you're starting this respiratory system, just come back once, read this basic findings and pathophysiology findings, especially in the morphological findings from the pathology point of view, and then start reading. After you read this from the pathology point of view, then go and read here. Now, what are the drugs you must read from the pharmacology point of view? I just told you, drugs of asthma and drug of COPD. That's it. Nothing more is required there. Okay. Rohit A asking, sir, is it enough to revise all subjects and not solving MCQs? So, is it enough to revise all subjects and not revise? What happens is, why do we solve MCQs? Let me tell you why. Why do we solve MCQs? Not because you should have a craze of solving MCQs. See, what happens is, basic idea of solving MCQ is to reduce your mistakes. Okay? The basic idea is to decrease your mistakes. That's it. Okay? To decrease your mistakes, what you must do is just practice a few questions on a daily basis, and that any error you are doing, just put that single error in the form of either a bookmark, or better, just put in the part of notes that you have already read there. Okay? Yes, classification other than mechanism action is usually not asked. It's usually not asked. Okay? How to prepare, Babita asking me, sir, how to prepare for para and preclinical subjects if someone didn't take any class directly or by video lectures? Okay. So what happens is, if you're from peripheral medical college, or you're from supposedly any government medical college in Delhi or NCR, it's all the same story everywhere. I'm telling you, the same story everywhere. Everyone has the same issue. So what I will suggest you is, try to go to the basics first. Ensure that your basics are clear. अब basic क्या होता है? देखो, basic क्या है? For example, you are reading respiratory system from the medicine point of view, and you do not know the idea or the pathophysiology of these things. It will be really difficult for you, and ultimately you will just end up mugging things. And after mugging things, आपको याद रहेगा, but only for a few days, but you'll forget a lot. So what you must do is, because you have time right now, time अभी इसलिए है because you all know कि exam अभी तो होना नहीं है. So because you know that, just give yourself an extra edge by covering at least the major topics from the pathology point of view and the mechanism of action from the pharmacology point of view. Achha. Sir, we joined Bhartiya in third year. How to focus, sir, and what do we do? Is Alkaira asking. Dekho, what happens, Alkaira? Suppose you are in the third year, right? So you're in third year. In third year, I told you, ask yourself to one thing. Is second year subjects almost complete? If you say yes, what do? Just do not move ahead. Just go here from here. Just go to read final year subjects. In the final year, at least read half of medicine and surgery from either a video or a live class. Okay? Achha. Suppose your answer here is no. Then first have a small window in the first few months and cover the second year subjects, especially the path and pharma, there itself in 2 months. That's it. And after you have done this, again come back to the strategy of covering medicine and surgery as we have already discussed. Achha. Neem Flower asking, should we study everything or only important topics are enough? Honestly, only important subtopics, nothing, never everything. Now you may feel कि सर क्वेश्चन तो कहीं भी जा सकता है. Yes, MBBS is huge. Body तो इतना ही है, just 6 feet का body है, but there's so many variety questions that you will actually not be able to cover everything. So because you know that you will not be able to cover everything, just come back and just limit yourself to the main topics only. Now you would say, sir, how would you get to know what are the main topics? Very simple. Take out any video or attend a live class. वहां को पता चलेगा which topic a faculty has taught and which topic a faculty has left out. So why does a faculty leave out a topic? Not because he doesn't know it, because it's not very important from the next or the need point of view. Achha. What is the time to cover short subjects? Honestly, very honestly, देखो. In any short subject, reading must be done in 3 days. In 3 days. Now this reading is possible only in a live class, right? But if you're watching a video, then it would take at least 7 days. Okay? What is possible for you? Because live class not possible right now. Just leave that. Just come back to this video for 7 days. And after 7 days, ensure that you revise once. You revise once after, you revise once after at least 2 days. And believe me, when you revise after 2 days, within 2 days, I'll say within 2 days, revise within 2 days, it is actually enough. Believe me, it's more than enough. Okay, third year is half done. Bharti student and I joined Bharti this year. It's too confusing and what to do. Dekho, again, let me tell you one thing. If you are in third year and you have joined a course, please follow the course. Whichever course you have joined, please follow it. नहीं तो क्या होगा? What will happen is even this is gone and also your planning is also gone. So actually what you should do, at least what you should do is please follow the course. Whatever is being taught, just read that thing only. Okay? For example, if you're in third year and suppose you're getting a class of medicine and surgery right now or say gynae ops, please attend that and ensure that what is being taught to you, you will not waste time again in the final year to read the again same thing in the same amount of time. In that amount of time, you can just revise and decrease some of your more efforts you can put there. Sir, I finished my MBBS and started internship. Okay. The working hours and after coming back is very tiring. How do we go for division of the time and what subject to do first? A very good question. Suppose, even though it's, suppose you're working somewhere. Okay. Now, when you're working somewhere, you know that in a day, you have only 4 hours. Now, beta, if you cannot put 4 hours for your preparation, it is very difficult for you. So I'm just considering 4 hours. Okay. In this 4 hours, you must first plan out. What is this plan? About 19 subjects, what are the most important for you? Because your importance will be different from my importance. Why I'm saying that? Suppose in first year, I have read physiology very well. So I won't read physiology a lot. But suppose in first year, I have not read physiology. Physiology will be the first thing I will take. Because without physiology, you will not be able to understand pathology and pharmacology. And when you don't understand these two subjects, you will not be able to understand the medicine point of view. So ensure to give a brief planning there. Now in the plan, usually if you ask me, sir, please make a plan for me, I will make a plan for you. In the first year, just take out anatomy and physio. Okay? And even though they appear quite vast, but believe me, please read only the clinical applications. Okay? Don't read origin and insertions. कोई importance ही नहीं है उसका. Read about in embryology that suppose the defect is in ASD or a VSD, what is the main defect there? बस उतना ही पढ़ो. Read about gastrulations and how does a gastrulation affect organ development, right? Read about the nerves emitting out from or exiting out from the spinal cord and just read there that if a nerve is compressed, where is the clinical features? So those are the applied importance. Don't read everything. In the second year, read the path and the pharma. Now again I tell you, in the path and pharma I told you what to read. It was very clearly told to you. Okay. Then in the third year and the final year, you have to read everything, but ensure that you at least read the clinical subjects well, and that includes gynae ops very importantly gynae ops, medicine, surgery, and pediatrics. Short subjects should be covered in only 2 days, not more than that. Okay, how to learn clinical skills and practice skills in the COVID time. So I hope you have seen many videos nowadays having so much clinical application that are done on the patient as well. So when you watch these videos, the things become very clear. But I'm very sure as the things get better and the medical college opens up, and when you go back to your medical college, you will be able to see that in a short amount of time. Sir, PSM कैसे पढ़े is not all interesting. Well, देखो, PSM is not interesting, I agreed, but what should you read in PSM? In the PSM, believe me, please read all the programs. Programs are so important, and along with this, at least read 2 topics, RCH chapter, along with that, a communicable diseases. These things must be very clear in PSM, else scoring becomes very difficult. Biostats is important, but just stick to the basic biostats there about the importance of this p-values, a very important thing. Importance of sensitivity and specificity is again very important, and just stick to the basic things in biostats. Okay. How to prepare for the next? So next is just an application of your all knowledge that you're putting. For next, The more important subjects there would be the final year and the pre-final years, but ensuring that 10% of the every topic would be from the paraclinical subjects. So first try to ensure the 90% topics and then go to 10% topics. ठीक है, 90% क्या है? 90% is your coverage of in a beautiful manner about the medicine, surgery, gynae, pediatrics. So just try to go there first. But to understand those things, you should have a good knowledge of your path and pharma at least. तो ensure वो ठीक से पढ़ना है और फिर आगे पढ़ना है. So I am from 2017 batch. If you join coaching in the final year only, देखो, if you took from 2017 batch, then there is a quite a good amount of chance that you have to apply for the next exam. Okay. Now, the point is, what should you do different for the next? The answer is nothing. Believe me, nothing. The only thing you should do is just be very true to what you're reading. So, any topic you're reading in the pre-final year and the final year at this point of time, you should be able to diagnose and treat a case. For example, suppose a case has come of angina. Do you know the clinical features? Do you know the pathophysiology? Do you know live diagnosis? And do you know the treatment? If you can answer these things in your mind only, I think the things is done. Focus on these 4 things in any topic and just keep on completing those topics, but ensuring that your paraclinical subjects are very, very good. So for that, I told you all the topics important from the pharmacology and the pathology point of view. Ensure, please read that. Okay. I am from 2018 batch and a second prof have not happened yet. Not likely to happen in say 2 months. College is teaching us 3rd year and we also are reading some final year stuffs. How to manage all these? Now this is a very sad scenario for you, Akash, because what you're saying is you are in 2nd year right now. Exams nahi hua. Okay. You are being taught 3rd year and final year subjects. Okay. The first thing you should do is forget about this. This will just kill you. It will only kill you, nothing else. It is just wasting your time right now. Because they don't concern about you doesn't mean that you don't concern about yourself. What you must do is focus here and focus here right now. Because anyhow, when the exams will be declared, आपको तो exam के लिए पढ़ना ही है ना. So don't at all keep reading pathology and pharmacology daily again and again. Focus on this one and this one. That's it. Once you're reading 3rd and final year subjects, again ensure कि जब भी आपको पढ़ाया जाएगा hypertension, तो you will come back and read the hypertension drugs from the pharmacology also. When you're being taught MI, you will also read the drugs of angina from the pharmacology point of view also, ensuring you read the pathophysiology of the same condition from Robbins also, or the whatever books you have read or the video that you have watched. Sir, how can you know the important topics in all the subjects? I not join any classes. कोई बात नहीं हमके. What is, again I tell you one thing, just watch the video name only. वीडियो का नाम देख के समझ में आ जाएगा आपको कि which are the topics to be covered. For example, if you watch गुरुकुल और गुरुकुल में आप देख रहे हो कि I have covered kidney और kidney में you are seeing that I have covered suppose PSGN, RPGN, MGN, MPGN, FSGS ये सब पढ़ा है. And suddenly you see I have not covered fibrinolytic nephropathy. आप छोड़ दो उसको. So that will give you a basic idea that what are the topics to be covered and what are topics you can just actually leave from there forward. ठीक है? Your Telegram group name. So my Telegram group name is by my own ID. My Telegram group name is by my own ID. It is called as Pathology by Dr. Praveen, and that is a simple way you can join it. Okay. So let me come back to the topic I was discussing. So I was discussing the topics of pharmacology. I have covered up to dyslipidemia. If you move to the GID, in GID the drugs of the peptic ulcer disease is very important. Drugs for elimination of H. pylori again becomes very important. Antiemetics is very important from every subject point of view. And if you're reading pediatrics, ensuring you should read about the drugs of diarrhea and constipations. Even though chemotherapy is not a very important topic, but yes, you must cover when you read about chemotherapies, read the microbiology and the pharmacology point of view together also. Okay, ensuring you at least read a few anti-drugs, for example, at least for those whose plannings are very important. Okay, in the PSM, for example, anti-TB drugs, anti-leprosy drugs, anti-malarial drugs. So these three are very, very important. Okay, at least know the drugs to be used and drug of choice mostly in the STDs, UTI, HIV, and the hepatitis along with malaria. So you see, all these are actually what? They are those things which actually are the programs you read in the PSM. So those programs you read in PSM, just come back in the second year and read those topics from the second year point of view there. Okay, what about the chemotherapies in the cancer? Cancer chemotherapy mein, the drug for the Hodgkin is very important, and the drug name for the ALL AML, that the induction therapy and concentration therapy or maintenance therapy, those drug names are important. You should not know the drug dosage or for how long it is given, because that is, it varies a lot. If a patient has achieved induction, it is obviously continued for a long time also. Just know the name of the drug is really more than sufficient there. How to read Robbins completely? Okay, first of all, this statement is wrong. If you're trying to read Robbins daily or say completely, you will never be able to read Robbins. Please समझो एक बात को. Reading Robbins should not be your aim. Your aim should be to understand pathology. So what you should do is, first of all, watch my lecture videos in the Gurukul, and after watching this, then go to Robbins and read that same topic. Please understand one thing. Robbins is a book read by undergraduates, and the same book is also read by the postgraduates, along with the Fletchers and other drugs and other books. But Robbins is a very basic book, and that book is covered by a lot number of people. So how would you make yourself a bit different from the others? Focus on what is important for you, and what is important for you is my videos in the Gurukul app. That's it. Utna pad lo is really more than sufficient, which also answers the question of Al-Qaeda. Are the video lectures enough? I can tell you, it is really enough. And if not enough, I'm there for you to come in the YouTube sessions and teach you the other remaining topics that you want to be covered there. So, Jam Kanam are asking me, sir, I am from 2017 batch. Medicine surgery are huge. How much time to be dedicated for each subjects? So very true. It is really very huge. So आपको क्या पढ़ना है? मेडिसिन सर्जरी और या कुछ भी पढ़ना है ना, आप एक काम करो, गो टू द गुरुकुल. आप देखो उसमें वीडियोस में क्या क्या टॉपिक कवर किए हुए हैं. ठीक है ना? That video topic will give you good idea and fair enough idea कि हाँ ये पढ़ना है, ये नहीं पढ़ना. The day you understand कि हाँ ये नहीं पढ़ना है, guarantee yourself a rank in PGM. Majority of the people and students get confused कि इतना पढ़ना है, and good students know इतना पढ़ना है. It's a basic difference of thought process. किसी को लग रहा है इतना पढ़ना है तो मैं कैसे पढ़ूं, और कुछ को लग रहा है इतना ही तो पढ़ना है और तो पढ़ना ही नहीं है. तो इतना पढ़ना उसको किसने बोला? It was told by the video lectures or the live classes, face-to-face lectures that you actually attend in any coaching institutes. Secondly, daily schedule for 17 batch. How should you cover final year university exams, PG, first year, second year, third year subjects? Very easy, guys. What you should do is, देखो, what you must do is first ensure कि आप किस year में हो, because you are saying that you are in 2017 batch. So I think you are in third year right now. Okay. So because you're in third year right now, you must cover first of all I, ENT and PSM. Okay, I, ENT and PSM. पहले तो इसको कवर करो, ठीक है. इसके बाद in the second year try to read systemic path again. अब systemic path में you all know the main topics. अगर मैं आपको main topics बता दूं, kidney in the decreasing order of importance, kidney, GIT, respiratory system, kidney, GIT, respiratory system. Then you must know about the cardiovascular system, including the vessels and heart. I'm taking both of them. Okay. Then if you look at the other topics like the CNS tumors is very important here. And then you keep on adding, but these are all in decreasing order of importance. Simultaneously cover medicine also. And when you read medicine, ensuring you read the pharma drugs. In pharma drugs, again repeat, do not read everything, just focus on what mechanism of action and side effects. That's it. Is it okay to use hard copy notes? देखो, hard copy notes is very good thing, but for that it's a bit dicey also, because it's very difficult for you to remember someone else's handwriting. But yes, if अगर आपका time नहीं है, you're an intern or a post intern, then this hard copy notes is quite handy and really help you to save some time. How to identify histopath slides when we complete our full syllabus? आपको इतना स्लाइड बनाया हुआ है, even I have covered a separate video in which I have explained to you around 50 histopathology slides important from any PG point of view or from a UG point of view. I think that practical video which I made in Gurukul is sufficient for you, and you can solve most of the histopathology slides there. Okay, so because we're in final year right now, let's move to final year now. So just what you do, just don't cover here, यहाँ छोड़ दो इसको, and just cover here. अब तो इतना difficult हो रहा है ना. Some people of 17 batch in final year and some people of 17 batch are in the pre-final year. So difficult because exam कहीं हुए कहीं नहीं हुए. It's so difficult for you to understand that also. हाँ देखो, इन नोट्स अब देखो वो सेम इमेजेस यू कैन नोट्स आपको नहीं मिलेंगे, बट आई जस्ट कीप ऑन वाचिंग द सेम थिंग, और द इट्स मोर इंपॉर्टेंट टू आइडेंटिफाई अ स्लाइड rather than just remembering a slide. इसलिए it's not very important to know the same slide in your notes. It's more important to identify कि what are the basic features, कि ये दिखेगा तो ये histopath slides हो जाएगा. Okay, because the same image will not come to the exam. The image will be different. So that different image you can identify it only when you know how to identify the slide there. Okay. अच्छा, before we move that, infectious disease is not very important. उसको छोड़ दो. अच्छा, a few more things before I end here. देखो, if my next point is, suppose if you have attended or watched, ठीक है, entire videos, आपने अटेंड कर चुके हैं फाइनल वीडियोस, एंड यू आर इन फाइनल ईयर, just do one thing, attend for a TND बस, और कुछ मत करो. This TND will be sufficient. Do not do anything else. The TND will be more than sufficient. So if you have attended and watched a final year up to final year subjects, then only you go for a TND in final year or internship, and so that you get ready for the next exam or the PG exam, whatever you are actually preparing for. This TND becomes very important for you in that respect if you have covered everything. But if you have not read everything, first watch a video or please go and make your basics right. A TND will not be helpful to you because आपका basic right नहीं है, और TND में हम क्या करते हैं, let you, TND will pick up some questions and we just discuss everything in and around the questions. So TND is good for revision. It is not good for basic learning. Thanks VP. Thanks really. Thank you. What is TND? TND is test and discussion. सर हमारा 18 बैच है, हम क्या करें, पीजी का कितना अलग रहेगा नेक्स्ट. सो माय आइडिया अबाउट नेक्स्ट इज, अभी आज के दिन में नन ऑफ द, समझो बात को, आज के दिन में none, 0% of the medical colleges are thinking about next. Everyone is concerned about teaching their own stuffs because वैसे ही बहुत पीछे चल रहे हैं. So no one is concerned about next right now, and so you must also not be covered about a next. You should also not be concerned about a next a lot. आप बस फोकस करो कि जो आप पढ़ रहे हो वो आपको बस याद रहे. That's it. Sir, should I solve MCQs daily? It's always better you solve MCQs daily. At least 10 to 15 MCQs in a time format. मतलब suppose you're sitting for solving MCQs at 9 PM and you have decided to solve only, or let's assume only 15 questions. तो ensure कि आपको बनाना है ये up to 9:20 PM only. Keep the last 10 minutes to look for mistakes बस, and nothing else बस. Always MCQ should be done in time manner. ऐसा मत करना कि you are trying to just solve MCQs without any timing. What will happen is you will always have that liberty. अरे आराम से बनाएंगे, ऐसा मत करना. Always give your mind that challenge कि I will solve 15 MCQs in 20 minutes, 100 MCQs in 110 minutes or 20 minutes. Do not give your time extra time, because your mind will keep on relaxing, and the relaxing attitude will completely fail when you attend for a grand test or in actual exams. Okay? Which app is ideal for questions? But you can take any app for a questions. Believe me, Gurukul is also very good app, and my questions have been framed by me also. In fact, I'll just tell you one thing. Just after 2 months, the entire pathology questions of the Gurukul will be completely clinical. Right now, I am making every clinical questions on every topic, and every video will have a question just after that, and you will feel love with it. Just give me 2 months. I'm working on it so that I will give you the best question ever possible for the next exam that you're actually striving for. Okay, thank you, student lifestyle. Thanks a lot for your ideal comment. And Kamaljeet, thanks a lot. So I think that is all from my side, guys. If you have any other thought, please let me know. I think this discussion was a quite fruitful one. You were able to ask a lot of doubts, and I was able to solve most of your doubts in the live sessions. If you found this things quite interesting and good, first of all, please like the video, and please put valuable comments in after the video gets stopped, because any valuable comment that you put is quite helpful for me also, so that I can bring a lot of sessions like this. Maybe I can teach you a few topics that you want, and please message me those topics that you want I can take the topics in my own YouTube channel or the DBMCI channel. But ensuring that, please first of all focus on your health first, and then everything comes gold only. Okay, so please like the video, and if possible you can share, and please put your valuable comments when the video is over after live streaming. Yes, I have definitely a Telegram group. Telegram group is called as Pathology by Dr. Praveen, and you can join that. Okay, thank you guys. Wishing you all the best, and take care. Good wishes. Stay healthy and stay happy. Bye bye.